I'm Marika Zapór from MAPS from the United States, and I'd like to invite people to come to
HoloMind 2025 conference.
With the aspiration and the growth potential, I look forward to seeing more.
The Polish specialists, the international ones. Honestly, the translation is so good.
And so being here is just a great opportunity.
HoloMind has been able to bring together a group of experts.
And that there's this sense that it's just at the beginning, that this could really expand here in Poland. About what's going on around the world and to try to I'm Marika Zapór from MAPS from the United States, and I'd like to invite people to come to
HoloMind 2025 conference.
With the aspiration and the growth potential, I look forward to seeing more.
The Polish specialists, the international ones. Honestly, the translation is so good.
And so being here is just a great opportunity.
HoloMind has been able to bring together a group of experts.
And that there's this sense that it's just at the beginning, that this could really expand here in Poland.
Good evening, everyone. My name is Magdalena Kaspryszyn, and I would like to welcome you warmly to HoloMind live panel discussion. Today's topic is Voices of the Community, Patient and Advocacy Perspectives on Psychedelics. Today, we would like to move a little bit beyond theory and policy. We have been speaking a lot to politicians, to scientists, to people who are responsible for clinical trials. But today, I would like to focus and listen to stories of people whose lives, stories, and healing journeys have given this field its real meaning. Today, we will explore how access and equity shape who receives care and what lived experience can teach us about resilience, how we uphold ethics and safety, and how communities can influence policy and public understanding. This topic is really vital because it's really ongoing. And I am really honored to be joined today by experts in this field. Let me invite to this very important conversation Jakub Nowak. Jakub is a board member and spokesperson of Social Initiative of Narcopolitics. Jakub, welcome very much, and I'm really happy to have you here.
It's an honor to be here.
Thank you. The next person I would like to invite is Marika Zapór, who is a neuroeducator and science communicator focused on the brain, psychopharmacology, and mental health, also founder of Mózg na kwasie, TEDx speaker, and also an active member of Social Initiative of Narcopolitics. Hello, Marika.
Hi, thank you so much for the invitation.
Great to have you. Thank you very much for being with us. The next very important person in this wonderful group of people is Théo Giubilei, founder and coordinator of Psychedelic Care Initiative and mental health advocate. Welcome, Théo.
Thanks so much. So good to be here.
I'm really happy. We have more wonderful guests today. The next person I would like to invite is Ian Roullier, who is the co-founder of Psychedelic Participant Advocacy Network, SaiPAN. Welcome, Ian.
Thanks, Magda. Yeah, it's great to be here.
And the last but not least, wonderful Francisca Silva from PAREA, project officer and neuroscientist by training. Welcome, Francisca.
Thank you. Thank you for the invite. Happy to be here.
I have a wonderful group of experts here, and I would really quickly like to give you the voice, because I think that this is a wonderful group to actually discuss our today's topic. And I would like to start with the first question, maybe a little bit general, but let's start from general and then let's move on to maybe more specific subjects. So I would like to ask you, what do you think is the role of community-based organizations in changing how society understands psychedelics? Ian, let's start with you.
Yeah, but there are many different strands to this. So I think community, as far as the work we do goes, the whole reason that SaiPan was set up as a network of former clinical trial participants or people receiving these treatments legally was because we need that diversity of experience. So while it was possible, I guess, for both myself and my co-founder, Leonie Schneider, to set ourselves up as maybe consultants in this area, as we've both taken part in 2 clinical trials each, that whole wealth and nuance of very individual experiences you wouldn't be tapped into. So I think it's very important that there is a broader community. A lot of the work we did in the first few years as an organization was really rooted in working with the organizations within this space that are providing treatments, whether that's, educational institutions like Imperial or King's College, or as time has gone by, the more commercial enterprises, like Atai, Beckley, Compass, etc., working with organizations like that, USONA, etc. But I think the main thing for us was that we really wanted community has to mean more than that. Not everyone wants to be an activist. Not everyone wants to be an advocate, So it's very important as well that we could create a true community and bring people together. And that's where we started providing peer support groups late last year. It took us about 2 years to get to that point, doing feasibility studies, etc., making sure it was a safely held enough space. But community is really all about connection, and it's great that some people do want to become advocates and do want to be in these, patient working groups, etc., which we can talk more about later. But it's really vital that we have a community that actually connects with each other and we have so many people in those groups that really haven't been able to speak to anybody else properly and openly about their experiences without fear of being judged.
And that's very important. Thank you so much. And Theo, I really would like to hear your voice, because your grassroots initiative is growing so strong and is so meaningful. What is your experience about it?
Yeah, I think, thank you again so much for the invitation. I think it's also, as Jan, is very important, I think, for many people to have a community to go and to be heard and to connect with people that have lived same experience, that share the same ideas, values, objectives. And that's what we saw through Psychedelic Care, that we received many messages of people that studied or got interested into the use of psychedelics, either for themselves, either for closed ones, either for relatives, or they saw Netflix documentaries and they see in this community-driven organization or these communities, they can see a structure in which they can actually go from ideas, values to action. Many people actually don't know, are interested, they don't have the structure to get their voice heard. And I think it's really interesting that we give that structure for people to become advocates, to become activists, or just to feel represented, to connect with each other. And that's what we're trying to do as a pan-European level. But I see so many initiatives within the countries themselves where people turn to in Belgium, in Poland, in Portugal. And I think it's very much important, if we want to bridge the gap between science, politics, between the general public perception, that we have a space that we gather and discuss together and actually bring that knowledge and pierce the bubble that sometimes psychedelics field is. So that's also what we're trying to do with Psychedelic Care.
Yeah, that's wonderful. And thank you for all the work you are doing. Francisca, Perea is very strong in advocacy and you've got great successes already. And I think more to come. Would you like to share your experience and your opinion, please?
Yeah, absolutely. I mean, I love that Ian used the words nuance, because I think that it's very important in the field, in the sense that we need to capture just a broad range of perspectives, because we really need the voice of every sector involved. And of course, this is a big purpose of Parea. We try to be a platform for all the different organizations, both across the psychedelic ecosystem, but also at the level of European healthcare. So we actually have 15 members, some European health organizations from the level of organizations of healthcare professionals, psychiatrists, of patients as well, and also professional organizations like researchers. So we really understand the importance of putting all these voices together and having this platform for exchange, because all of these perspectives need to be represented. And we also have a wide community supporter network, which then kind of builds this bridge with the psychedelic ecosystem more at national level. We are happy to have Hollow Mind as a part of that. And we are also very happy to partner with Psychedelic Care from the beginning. And really, it's all about exchanges and collaborations and having everybody's voice represented.
Yes, that's very important. Thank you so much for your voice. And Marika and Jakub, you are both part of social initiative of narcopolitics in Poland. And now I'm really, really interested in the situation in Poland. How do you see it from your perspective? Maybe let's start with Marika.
I would say that grassroots groups show that education can start anywhere. Maybe like festivals on campuses or on Instagram. That's what we do. And we can use peer-to-peer methods to reduce stigma. In big cities, this model already works. So in small towns, people need trusted local messengers, and we can be those messengers. Pharmacists, psychologists, students of this can be those messengers if they get short trainings, simple toolkits. We show maybe some posters, checklists, referral lists. When NGOs partner with pharmacists or psychologists, they can run like micro events, like Ask Me Anything, evening safe use basics, or integration circles. And I think this is low cost and high impact. Community engagement turns policy from abstract to practical because of this, and it shows decisions makers that safety grows when education just meets everyday life.
That's very important. Thank you so much. Jakub, what would you add to that?
Our organization mostly focused on harm reduction, drug-related harm reduction, and outreach social help, mostly in party working branch. So we go to parties, we educate there. And we met a lot of community of people who use drugs, a lot of psychedelic drugs users. And I think that this group is absolutely most important in this psychedelic revolution that we attend, because they are holders of the culture of psychedelics, because psychedelics are psychedelic experience is our cultural heritage as humankind. I think that this way, and these people who use psychedelic on themselves want to discover these experiences are the holders of this culture, and it's very important because there are a lot of companies and um, a lot of companies, big pharma companies, that want to privatize psychedelics, and they are our heritage as humankind, and this community and these people who use substances are very important in this area of thinking of psychedelics.
That's a very important voice. Thank you very much. As you all notice different needs and different challenges, and you also, I think, work with different groups of people connected with psychedelic use, let's call it like this, or psychedelic therapy, psychedelic assisted therapy. Or working for better access or improved access to this therapy. I think that we have now a huge scope, from what you say, of different communities that we are now talking about. So I would like to ask you, because probably during your journeys, you must have at least once asked yourself a question: how to organize the collaboration between researchers, patients, communities, to be the most promising for the future, to make it work the best. Francisca, what do you think?
The first thing that came to my mind is really to identify those shared priorities and values. I think that we can all agree that we would want to work towards a better society, a society that's feeling better, that might have better options for their mental health, and also in terms of the support that they can find in their communities and for the experiences that they go through. So I think it's identifying those bridges and communicating with each other and trying to work together. So really searching for opportunities to have the exchanges and identify those common goals, because I think, you know, sometimes I feel like we have the image that especially now with the whole field kind of booming and going in all different directions, I think it's easy sometimes to be stuck on the parts that appear fundamentally different. But I think maybe there's a lot more points in common that we can work towards. And I think the beauty about this field is also its richness. And advancing in one direction does not mean that you can't in parallel advance in another direction. In fact, I think it's quite the opposite. I think by going in one direction, you can also take those learnings and it will help the whole ecosystem. And it's about doing so ethically and responsibly and with awareness. So that's what I would say.
Yeah, that's beautiful. That's beautiful. And I wish that would be so easy to achieve, but I'm quite sure that it's still possible. Théo, what's your opinion on that? How to build this cooperation?
Yeah, I think I very much agree with what Francisca said, that with common goals and common values that we're stronger together and we have to identify them. It doesn't mean that we have to agree on everything, and I think that's very much true for different European Union countries. We're not going to go at the same pace, but personally, and it's the story I like to tell, is that coming from Strasbourg, eastern France, it's 2 hours from Switzerland. And was getting more interested into this field, I just realized that's kind of unfair that Swiss citizens can have access to those therapies, of course, under certain conditions, and not French citizens. And now it appears that German citizens will have access to compassionate use, and maybe will be broadened in the coming years, and Czech citizens as well. And as Polish, as French, as Italian, I think that's kind of unfair and not the idea of Europe I make. And that's how, as there is a mental health crisis. I mean, it doesn't. It goes beyond borders, and that's why we need to work together as a community to actually address the needs in every individual countries, and that comes through the European Union. And I think that's the idea of Europe, that we have the same access to health, and which is not true today, and that's what pretty much we are working for. And I just also, there's, I think, another layer, because we're speaking about health and medication therapies that could help people with dealing, as Francisca said, like with dealing with difficult situations. But there is also a political layer on mental health. There are political reasons why we, as a society, we are doing bad things. So that should be addressed. I think psychedelic experience can address those situations. Not saying that we should all, because it will change society and it's going to be miraculous, but if we are true to ourselves, there need to be political decisions about society and how we deal with mental health that create their own mental health problems, and then open all layers and all possibilities for getting the best access to treatments that work. And we need, of course, more research. We need more cooperation, and we're not there yet. But I think we need really to act on these two levels. Otherwise, we will again act on the symptoms and not the causes. So that's very important and part of awareness raising and groundwork. And yeah, that's what I would say on this.
Yeah, that's very true. That's very true. Thank you very much. Jakub.
Yes, I think that the first step on this trail to a rational and effective way of policy due to psychedelics is the criminalization, because we can't let this situation happen when you can take psilocybin or LSD or DMT inside of the private clinic, but if you do it on the street, you go to jail. It's the way to make psychedelics good only for people who are in power and in control with money. And if we think about psychedelics as a method of starting of work of our inner healer, so we can't let people use their inner strength only if they pay money for private clinic. So the first step is decriminalization, and all the organizations of psychedelics and drug use in Europe should focus on decriminalization of the substances. Researchers are extremely important. Yes, extremely important. But this basic human fairness about the criminalization for users on the street is, I think, the most challenging and the most important part of it.
Thank you very much. Ian, do you agree?
As far as collaboration across the different, say, sub-communities, if you want to call that, I think it's really vital. And I think as these if we're talking about treatments, then as they become more corporatized, there's a much more of a drive towards protecting intellectual property, etc. And I really think that once you get too bogged down in that, then we lose a lot of the value of taking the approach we should take, which is to openly share knowledge between ourselves, between these different communities. There's a lot of overlap, there's a lot of common ground, there are a lot of different things that we can learn from each other, and we will get to reach our goals of ensuring that, you know, I would speak from Saipan's perspective in that we are looking more at the, you know, the clinical trials and clinical treatments rather than other use of psychedelics. But if we pool our knowledge, these treatments will become available much more quickly, and they will be delivered more safely as well, you know, because we are all working together. We have those common strands of what does best practice look like, what can we learn from each other. And I think the worry is that once people start becoming guarded and closed and trying to protect their assets, if you like, which is what happens with the profit motive, that we might lose that, and you'll have several different branches slowly growing outward, when really you could get to a much better place much more quickly if you all work together. And that's an example of how we've helped to do that as an organization, was by creating it's a patient working group, but we called it the Participant Collaboration Council, that we set up with Beckley Psytech. So the idea, yes, they are one of the, you know, corporate entities within this space, but the whole idea of that was you work together. You know, there was a group of us working together. You work out what the common strands are of experience, and then you put out recommendations and insights, and you share that with the whole sector. You share that with everyone. You share that across the board, you know, and by doing that, that's the only way that I think we can safely get to, you know, where all of us want to be, where these treatments are safely available to people, and, you know, people that have lived with chronic health conditions, that these treatments seem to be, you know, they seem to be effective in treating so many different chronic health conditions, if the current scientific research bears out, we can get to that point where people that have desperately needed alternatives can finally access these treatments.
Yeah, that's really important. Thank you so much. Marika, what do you think?
I would say, first of all, impact comes where science meets empathy, and researchers, of course, bring data, clinicians bring practice, advocates bring language and a culture. But I think pharmacists can connect all three because we understand pharmacology, we speak to the public every day. And for me, education is an access, and pharmacy can be the bridge that we can work together and we can influence some change. Because if you connect clinics, NGOs, local pharmacies, people also in small towns will get the same first step as people in big cities.
Yeah, thank you very much. And it looks like as I hear you speaking, I think that it looks like we have all the answers of what we need, what is necessary to be done to actually create the best environment for that. But at the same time, we are not there yet, as you said, though. It's like we are in the process. We are still going. So therefore, I would like to ask you another question that came to my mind listening to you about access and equity. But before I do that, I want to just underline that our viewers, and I see that there's more and more people coming, and I'm really happy to see all of you there. Please remember that in the second part of our conversation, of our discussion, there will be an option for you to ask your own questions. So please make sure to write your questions in the comments, and then we'll choose those that we find important and vital to ask to our experts. So you also can have the voice in this conversation. Please remember about that. But coming back to the discussion, as far as access and equity, as we speak about all the possibilities to join forces to go farther, if we know so much, if we understand what could help us, if we know how to name the needs, how come do we still have barriers? And maybe I would like to ask you to name the biggest barriers and obstacles preventing equitable access to psychedelic assisted therapies today. Jakub.
We are fighting with about 70 years of drug war. It's, I think, the most hardcore barrier we can imagine. We all of the strength of the countries, countries as powerful as United States, which love this policy all over the world, the policy of fighting with psychedelics with all the power of the state, and we have to bury out of this grave, because we are in the grave of psychedelics because of drug war. And now it's this new dawn of psychedelics. We research, we try to fight taboo, we try to fight for rights of drug users, and it's extremely important. But it's very hard because policymakers are mostly white guys over 70, 60. They are still in this mindset of hardcore drug war. So I think this fight for psychedelics is on the good way, because it's estimate that market of legal psychedelics in the United States will be valued about $7 billion to 2027. So it's a lot of money. So it's not if, I think it's not if, but when. But our policymakers in Europe are people of very conservative mindset. So it will last long, and they will give us obstacles on this way.
Thank you very much. That's powerful. Théo, when you work with your communities and you advocate for psychedelic assisted therapy, do you actually see the same case as Jakub is mentioning? Is that really the biggest barrier?
I think I was speaking about the different kind of type of use. There is the psychedelic assisted therapy segment, and there is the use outside of the medical. We are focused because it's the European Union focused on the psychedelic assisted therapy, the psychedelic therapy use, because it's the competence of the European Union. They couldn't legalize the use of these substances, so we're really focusing on getting the European Union to take action. I think that's the main barrier. First is time, because these things take time to implement. We're seeing now it's under development at the European Union level. Within the Parliament, there is some interest from the EMA, the European Medicine Agency. There is, Czech Republic and Germany moving forward. So of course there is time, and we need time because we need research, and especially because when we speak about psychedelic assisted treatments, we are talking about helping people who are at risks. So we need that to make sure that it's safe, it's the safest and also affordable and equal access, and that takes time because it's how healthcare systems work, and we need organizations like PAREA, like PsyPan to bring forward evidence and to be part of the discussion. But the discussion takes time, and policy, you cannot make policy. That's for the safety of the patients most of the time. So on the other side, through psychedelic care, through our work, the main barrier is either it can be stigma on one side, but lack of awareness and lack of information. For example, Germany, within the psychedelic ecosystem in Europe, the Germany news was big. We didn't see many headlines about that in Germany. I asked my German friends, they didn't hear about it. And so in other countries, they wouldn't hear about it. At the European Union level, it didn't make news as well. But for us, it's a big news. So I think there is a lack of information getting to the people, maybe a lack of interest from the media on some level, because there is a lack of interest from the public. And that's also our part to show that there is enough evidence and enough interest that it should be part of the public debate, so to accelerate things. But I feel like most people don't know there is a stigma, and for politicians, that's the main barrier, is stigma for the politicians. Because we heard many. Tomorrow we're meeting a Belgian politicians that didn't want really to be outspoken about it. They just want to know more, take time. Others that say, yeah, I saw the Netflix documentaries, and politicians at the European Parliament, I fully support, fully agree. Socialist Party never will be outspoken of for now, because there is not an interest for voters, because it is not in the public debate yet. So it's a long work to get the word out, to pierce that bubble that we are in sometimes within the psychedelic ecosystem. And that takes work from the ground and from the communities, and working with influencers, with public figures, with artists, and with a strong messaging. That's kind of what we are doing, and there are many other layers. But I think you have to do both at the same time. The rigorous scientific research for the specific use of psychedelics in therapy, and on the other side, a long work for destigmatization and sharing the proper information, so the politicians will move forward from public pressure, for public awareness. Pressure is not a good word to make
that's right. Yeah, but I think that you have managed quite successfully to bring this topic to the public debate. You brought psychedelics to the parliament. Psychedelic care went to parliament together with PAREA. I was there with you. I remember that it was a beautiful event, and many politicians were interested. But I do agree that on some level there is interest, and there is a lot that is being spoken about. But at a certain point there is the stigma, and I think that this is the part of what Jakub mentioned, that this war on drugs is actually the result of it is the stigma and the misunderstanding of different types of substance and different use of them for different reasons. So I think that we still suffer because of this. However, I do believe that with education, as you mentioned, and with the proper debate, we can actually change it. Marika, what is your opinion about it? What are the biggest barriers?
I would say, for Poland perspective, I think it's geography and stigma, first of all. like in big cities, we can find private clinics and people are open to mental health or in using substances. But in small towns, people are afraid to even ask questions. Another barrier, I would say, language and a cost. Maybe cost even more, because many resources are only English, the good resources, I mean, and some of them are available only privately. I think this is a problem. And also, I think the barrier is that we have lack of trained professionals in this topic, and we need to educate some people to make education to the others. That's why I believe in pharmaceutical care in our Poland. Maybe we could educate on this risk and guide people to safe information. So this is three barriers from me.
Yeah, that's very important, and education is always important, either to the
Yes.
therapists and specialists, because that's one level, but also just to the public, to make sure that everyone is aware of the full scope of what this method offers. Francisca, what do you think about that?
Yeah, I echo a lot of what has already been said. What Théo also said about time. I mean, at Parea, we are working in the context of trying to get psychedelic therapies to be approved and accessible in regulated, legal, safe ways. And if you're talking about the process of developing a new treatment, of getting it approved, and we recognize also the importance of synergistically drug policy work as well. But when you're talking about this kind of long path, there's also very practical barriers to equity there. I mean, for starters, that's already a long path on its own. Then if we're talking about a process of, for example, having a centrally approved treatment through the EMA, in theory, that should reach every European country. But we know that in reality, to actually integrate this nationally in different healthcare systems, there's some very concrete barriers there in terms of pricing and reimbursement decisions, for instance. We know that it takes a very different amount of time in each EU country for a new treatment to actually be accessible. And it can be up to a really long time. So I think this, to me, also emphasizes again the importance of trying to do the work kind of from a top-down at the European level in terms of advocacy, and also in terms of engaging with all the necessary regulators. So kind of this top-down work, which is what Parea really focuses on. But at the same time, we want to focus on, and this connects also to what Marika has said, what Théo has said, in terms of information, awareness, and education. Because let's think, for example, in terms of practitioners, healthcare professionals. I mean, they're going to be, in a way, gatekeepers to this later on. So we think it's really important in parallel already to start engaging directly and sharing good, balanced information now, you know, understanding also what are their concerns, because very often it is lack of good information, sometimes still a little bit of stigma. So I think it's important to work at all of these levels. And it also represents here the importance of doing, central European level advocacy, but in parallel aligning with national initiatives as well. You really need both.
Yeah, definitely. Thank you very much. And I think Parea is doing so much towards this direction, and we are really grateful for all the work that you are doing. Ian, from the patient's perspective, what is the biggest barrier?
I think just to reflect on what others have already said around stigma. I mean, if you're a psychedelic assisted therapy clinical trial participant, you have several layers of stigma to deal with, because not only do you have the fact that you're taking what are still largely illegal drugs during these treatments, so there's the stigma around the substance itself, but you've also got very often the ongoing stigma around your health condition as well to deal with. And then there's also another layer of misunderstanding that people don't really take into account, and that's the very nature of taking part in either a clinical trial or receiving a psychedelic within a clinical environment. And again, this is where the peer support groups are so helpful, because all of those things that people are rejected for, or people roll their eyes, or people just don't understand, it's not always from a bad place. People can just fully open up and be seen, heard, and understood. But I think as far as access and equity goes, the demographic that these treatments are available to via clinical trials largely at the moment is still way too narrow, and that desperately needs to change. And it's really reflective of the existing societal inequalities that exist. And yeah, we need to do all we can to change that, because we have to do better, because people from marginalized communities suffer disproportionately from many of the conditions that psychedelic assisted therapy is being used to treat. So we really need to address that. We need to do that now, because the worst case is that this then rolls out when these become treatments as well. And it's like these treatments only become available via healthcare systems privately. And again, people are priced out. It's then just available to those that can afford to pay for it. And that's exactly what's happened in the UK with cannabis and ketamine. If you can't afford it, you can't really access it. And it's just replicating and reinforcing existing health inequalities. Ways to address this, I mean, when it comes to the treatments, you would hope that there would be some subsidy available. But as far as where we are now with the clinical trials, I mean, at the very least, expenses should be paid for. But I think we need to be looking at paying people to participate in trials, having a budget for that. We are talking about, multi-million euro clinical trials. So surely that can be factored in. And yeah, so people have different needs. If people were in low-paid jobs, or they need help with childcare, for instance, to be able to have access to some funding so that they can actually take part in these trials. Because if you look at the demographic that is largely the people that are able to take part in clinical trials, they're very often white, middle class, and educated, and that has to change. How do we go about changing that? I think the financial aspect that I've already mentioned is really important, but we really need to work with marginalized groups to work out how best to support them in taking part and being able to take part in these trials, and how best, once they do become treatments, how we manage that as well. And I think it's really, really important, and it's something we need to do both with marginalized communities, but with people receiving these treatments as a whole, is not to assume on their behalf. Speak to them, ask them, survey them, find out exactly, have them in the room, when you're making these decisions.
Yeah, and that's really important what you are now saying. I need to ask how to do that, how to work with those groups straight away, because there must be a way.
There is a way. I know that MAPS did a lot of work to diversify the pool of participants they had. So there is hopefully some learning there that can be spread across, at least the clinical trial people that are providing the clinical trials. But it is really about it. Again, it's not for me. It's not for me to say, because again, I am a white. I'm from a working class background, but I'm white, educated. It's like I'm not part of the problem. I'm trying not to be, but it's like you need to ask people from within those communities, like, how can we do this? We work together and have people in the room working with organizations providing these treatments. It's really, I have ideas, but I wouldn't be as bold or naive enough to say that I can make those decisions myself. So yeah, that's not an answer, but it is, hopefully.
Yeah, that's fair enough. I think that it's actually true that it's hard to speak for people who are not included into the dialogue. So we cannot decide about them. It's rather about reach out and actually get to know what the true needs are. As you said, MAPS has done some work in this direction, and that's really valuable. But the question is whether it's still such that the marginalized groups are the margin also in this area, because there is no business in it. Let me ask this question straight. You have already mentioned, I think, almost everyone here, that the business is a big part of that we are still afraid for this not to become the machine for earning more money. And there is a very thin line between helping people and providing them with the support and making it just a straight business. So do you think that this is the reason, or there is some other potential problem that we are not going this way? Marika, how do you think?
It's a hard question, to be
I know it's a hard
honest.
question. Yeah, but we have to start somewhere.
I would say still, I think the problem is the cost and being affordable for everyone, and the geography. So I would say maybe the solution could be local points, like local pharmacies or local points with NGOs. Maybe this could make us one barrier go away. Really,
Yeah.
I don't know.
If it would be, some easy question to answer, I think that we wouldn't have to raise it here, right? So
Yes.
I'm making your lives difficult right now asking it. But I think that this is why we are here, to actually touch upon the things that not many people want to speak about. But I'm quite sure that we don't need to know the answers. We don't need to find them even right now. It's a good opportunity just to brainstorm that a little bit. So I'm quite sure that
I think it would be better, because for me, this is the problem I can see. Maybe there's others I don't see now.
Yeah. Francisca, what do you think?
I was going to add, kind of off the top of my head, and I'm also not an expert in this, but if we're talking about clinical trial and clinical trial participation, I mean, people in general who are maybe not doing very well, and in marginalized communities as well, but having difficult lives, you don't really go out of your way to look to participate in a research study necessarily. So I'm sure out there that there are ways, as was done in the MAPS trial, to kind of take this into consideration when recruiting for studies. You really need to, because, also just in general, one of the big background things when it comes to this, it's not even specific to psychedelics, but it's just, we are assuming that we're already talking about maybe a population that in a way has already reached out to treatment, and that's how they got recommended to a trial, but a lot of people don't. So I think this kind of goes back to stigma again, and in this case, more stigma about mental health in general. So I think it's about being intentional in your recruitment efforts to really reach the people who need it, the people who are struggling, and people in marginalized communities as well, who are maybe even less likely, and geography is surely a factor, and many others, they're even less likely to become aware that this is even an option. And even if they do, is it going to be their priority? So need to be really aware of this.
Yeah, that's quite true. Jakub, what do you think?
I think that people even don't, from marginalized group, and I think from most of the society, even don't know they can use this kind of help, because it's not mainstream knowledge. For us, it's mainstream knowledge because we are in this drug policy, psychedelic study business, and we know this type of things. But for normal people, this is mostly topic of illegal drugs and extremely taboo. I think that for policymakers, it's so taboo that they don't want to get involved in changing ways of psychedelics in society because it's taboo, because it's illegal drugs, it's connected with club culture, it's connected with hippies, it's connected with people who are not interesting for this type of people who are policymakers, white guys over 70. So I think in this way, they don't know they can use this kind of help.
So again, education and spreading awareness.
And
Yeah.
sorry, can I one more word? Education, but not this kind of education we mostly do because we educate ourselves and people who are interested in the first place. I think that we should educate doctors in these small communities, small cities, villages, doctors of family doctors, people who you go when you feel sick, when you have problem in the small communities. Sometimes these kind of doctors are very connected with people who they treat, old people, lonely people, marginalized people. We should talk with people from healthcare system and but practitioners of this healthcare system, but on the lowest level, not making conference for interested people who may also making these conferences. These are important conferences for people who are interested in this topic. Uh, but I think also important is going straight to the people who are working for people who have good care, healthcare, this healthcare system, doctors in the villages, doctors in small health institutions, and talk with them because they don't know anything about it. They heard something about psychedelics, maybe, but they have connections with patients from marginalized groups. They can talk with them and they have authority.
Oh, that's a very important voice. And actually, Jakub, as you say that and mentioning the conference, because we do have a conference, Hollow Mind conference, coming in less than a month, 15th and 16th of November. And actually, all of our guests here, you are either speakers or partners of the conference. So this is a very good community to speak about it. Jakub, how can we access those people that you are talking about, those practitioners on the very bottom of this line with the conference? If you have an idea, I can speak for the whole Hollow Mind team that we would like to try that. How we can invite them to the conference?
I really don't have experience with Polish public healthcare, and I don't think that I'm a good person to advocate about reaching doctors in village hospitals, village. I don't. It's doctor from small communities. I don't know these people because I work in advocacy in rational narcopolitics and I work mostly for harm reduction reasons.
Yeah.
But I think that working they are target and I think that they are also interested in other ways to help their patients. In Poland, in the eastern wall of Poland, we have a mass uh, outbreak of suicide of old, lonely male people, people with in age of our parents, grandparents in villages. They are frequently left alone by their families who move to the cities, and there are a lot of suicides in this group. A lot of alcoholism, a lot of suicides. I think that this group could benefit from psychedelics, and their doctors who see they vanish in their eyes want to help them. So I think that this group would be interested, but we have to find a way connecting with them.
Yep, I am a doer and I like doing things. Our discussion is great, but I do want to get something, valuable also in a practical way out of that. And I'm thinking that if we were able to create a list of such practitioners, like preferably with some email addresses, I'm quite sure that I can speak for the whole Holomind team that we would be able to give them some access to the conference online so that they can educate themselves just as a contribution to what you are talking about. So maybe we can think about having this kind of cooperation for that matter, so that we can try and find some practitioners in this kind of areas, so that to invite them online, because I'm sure that coming personally would be probably a little bit difficult, although it's also possible. So if you are interested in this kind of an activity, I think that we could do that together.
But we will talk about it in our organization.
But take that further, because I think it's really worth this. I believe in doing things, and that's a great opportunity to change something really at the bottom. But I really want to hear Théo speaking about those marginalized groups. So how do you think it's been already quite a lot said, but why the margin still appears even in this area?
Well, also as Jan, I don't feel. I mean, I'm not the most legitimate, also, or the most knowledgeable about this topic. I know that, as Tali said in the chat, that marginalized groups, they have tendency to have. I mean, the depression and anxiety and PTSD are higher in marginalized groups, as Tali put it. I think that the current framework of the use of psychedelics is unequal in itself, because the access of information is definitely unequal when it comes to psychedelic and the benefits. And when we look at the population also interested about psychedelics, the therapeutic use, you don't see a lot of marginalized group representatives in this ecosystem. And mainly now, and that's what we see also a problem, and we receive messages about that, is that currently you need to speak English. You need to have the money to travel to go psychedelic retreats. You need to know about the psychedelic retreats. To be sure that it will be safe for you. You need to educate yourself. You need to have the time to travel there, and that's only a small fraction of the population. So the current use of psychedelics in therapy, let's say, outside of the completely medical context, it's deeply unequal. And we receive messages that last, and just to give also voice to the people, or the patients, from the initiative side. On the initiative side, like, we received messages like last week from a person in Italy saying that she suffered from treatment-resistant depression, tried everything, and she learned about psychedelics, and she thinks that's the last thing that could help her before committing suicide, or that's how she puts it. But she said, I don't speak English. I cannot travel to Switzerland because it's only Swiss citizens. I don't have the money to access those, and I don't think it's going to happen easily in the coming years. What can I do? And you arrive with these questions, and but it's just frustrating because we feel like if the European Union would take action on that, so that the countries would implement kind of not at the same time, but like a common direction, that you could get reimbursement, you could get also the information that you could have access to the treatment through your psychiatrist, through your doctor, through your general doctor, because then through implementation in the healthcare system, then you have training and you have information that is disseminated. And for now, it's kept because it's not implemented in most of the countries. And I fear, also will be interesting what happened in Germany, who has access to the compassionate use in these two clinics. And it would be interesting to see the population and learn from that, so we don't repeat the same mistake for the other countries that will implement. Because I know in Belgium now they're trying to push also for compassionate use, but we need to make sure that marginalized groups are taken into account. I know for clinical trials it's a very sensitive, complicated topic, and I don't have the expertise to speak about that. And I know it's super hard to get the information that there is a clinical trial. It's already a burden to get marginalized groups. So there's a lot of work, but we feel that through the implementation into the healthcare system, it will be at least more equal than it is right now into access. So that's kind of what we're fighting, and also affordable. That's really the core that we need to make sure that there is the impact studies that the European Commission could do, all these things to make sure it is affordable to the people in the end, because we can implement. If it's not affordable, it's equal again.
Mm-hmm.
Yeah, definitely. And, I think that we have mentioned already such a huge bunch of barriers and obstacles. I don't want it to look like there's only that, but I think that this is also very important to understand that these are the problems that we have on every layer of our social existence. So the society has those problems everywhere. So it's not only psychedelic assisted therapy or use that has this burden, but it's just actually even access to regular healthcare is also very often limited because of the same reasons. So I think that we have a lot to do as society in general, but maybe this work that you are all doing will actually bring some new level to also other areas of social mindset. I really wish that would be happening soon, and I really believe that. Why not? It's quite possible. But there is another thing that we have not mentioned yet, and it's a little bit connected with what we were talking about just a moment ago, because it's ethics and safety. Ethics and safety is the part of the dialogue where there is also quite a lot of concern, and this in my mind creates another, let's say, another reserve towards the therapy, because this type of therapy, or generally the use of psychedelics, makes people quite vulnerable and quite easy to, well, influence or maybe even manipulate. So there are cases with some misconduct or even abuse. We know about that. So how do you think this could be handled? We know already about different cases, but is that already the level that we can say that, okay, we have learned our lessons and we know how to go further, or is it still a huge field to work on? How do you feel, Francisca?
I wouldn't say that it's a one and done. We've learned our lesson and we can move on. I think it's something that needs to stay present in the conversations. I will say that I think one positive aspect is that I think there has been progress in how often we are talking about these things. I don't think we can talk about psychedelic therapies anymore without considering these things. That's the level that we are. More and more we are understanding that this obviously is essential. So I think it is continuing to do that, to have those conversations. We need to, it brings back nuance. We need to be balanced in our approach. It's normal to be enthusiastic about psychedelic therapies. I mean, they have the potential to bring hope to a lot of people and to bring a lot of important options to people. But the expression is used so much, right? But we can't sell them as a silver bullet, because they're not going to be for everyone. And there are risks involved, but it's about talking clearly about those risks, because probably those are not the risks that years and years of stigma have told us that they are. It's a different kind of risk. And I think, again, it's about talking about it openly, understanding it more, researching it more, listening to people who have gone through things like that, listen to the whole possible nuanced and extensive variety of experience, and not pushing certain things to the sidelines. And you need this across areas of application. Again, if we are focusing on the development to be integrated in healthcare, also for very practical purposes, this is absolutely essential. When you're developing a new treatment, you need to understand every single thing that could possibly happen that would go wrong, because people need to have this information beforehand, while at the same time being very careful with the language that we use to also not scare people at the same time. It's just again, about rationality, balance, and kind of intentionality in our language, and accepting nuance. We humans, we like to have very black and white pictures of things in our heads, but we are also all capable of holding multiple ideas at once in our heads. And I think that's the way to go.
Definitely. Yeah, thank you very much. Ian, how do you think?
Yeah, I think when it comes to ethics and safety, I think that again we go back to the profit motive that is increasingly prevalent. And yeah, that's necessary because we can't change the whole system. We can't change capitalism. We can't change the way the pharmaceutical industry works. So this is the way that we're going. But my worry is that the drive to bring these treatments to market as quickly as possible means that corners are going to be cut, and we see that already. I think is largely behind certain people within this this space who want to do away with the therapeutic component. I mean, I know there's an issue with regulating therapy, etc., for the EMA and FDA, etc., but I think there are enough like amazing brains in this field to be able to overcome that and work away around that and through that. But it's hard not to be cynical sometimes and just see that as a way of saving money. And my worry then, I mean, it's important to say, as Francisca said as well, you know, that it's understandable that there's like many of us have this drive for these treatments to become available as soon as possible, but also as safely as possible, because there are so many people suffering with chronic health conditions that all other treatments have failed to help. But if we cut so many corners in getting to that point, my worry is that people will not be safeguarded. People will, all it takes is for there to be a snowball, people being spat out at the end of trials or after they've been treated, once they become treatments, and people just, you know, lives being lost, the media picking up on that, politicians then also get involved, and everything just comes to a halt again, and we end up exactly where we were before. You know, that's a huge fear. I think as far as ensuring, that's the whole thing with psychedelics. It seems that the way they work is via that, you know, opening people up, creating that vulnerability, creating that space for change, for neuroplasticity, etc. And that, if that is managed in a way with people that can be trusted in the space to support and help someone through that, that's where the potential lies. But if other people, you know, have a different, have like ill intent or whatever, and want to use that to be able to, you know, violate boundaries and abuse somebody, then we really, really, really desperately need to ensure that is minimized as much as possible. Obviously, there are organizations like Psyware that exist to play that role for people where that has happened. And they are like that's the whole thing. That what gets me, again, it's about money, but organizations like Psyware are like really woefully underfunded, and there are billions of euros within this sector. The people that are making those financial decisions really need to do better, so that there is a full ecosystem around people receiving these treatments. Yeah, sorry, I'm good sort of getting on my soapbox slightly, but it's really, really, really important. And I think as far as like what's the right way of going about, you know, what does a code of ethics look like? What do we need to ensure that people receiving these treatments receive? Like, how do we work that out? Speak to people that have received these treatments. It's as simple as that.
Yeah, the information and a lot of concern around the topic of I think protocols as well. But at the same time, I can't help but thinking about the great article that you have just written about celebrities and people who use not maybe the straight psychedelic to actually violate someone, but they use the notion of it and the power that they get within that. I think that this is another level of safety and ethics that is also important, and also can create a lot of harm. So
it's really tough, because you have this field of energy and this field of like new treatments, and they're not really, because they've been used for thousands of years in other settings. But as far as medicine goes, as far as conventional NHS system, like national health systems go, or whatever, it's this field, and it's like you're pioneers, you're kind of, and people start holding other people up. And I think that happens in all aspects of life. It's not just specific to the psychedelic sector, but I think that's a really dangerous path to go down. I think some people can deal with that kind of being held up as gods. And it's really difficult to negotiate this, because of course you get the same names at repeated conferences, etc., and people are held up and people are respected and revered for doing amazing work. And I don't deny that happens. But it's when people are seen as being above reproach, or people they're not called out, their behavior. We know of examples where people are predators within this space, and there's this kind of closing ranks. We need to protect the sector, and that is a really, really dangerous place to be. We need to stop doing that. We need to call out. We need to constantly be questioning ourselves and others within this space, and we need to call out abusive behavior whenever we see it. We all have to do this. It shouldn't be on the people who have been the victims of this kind of treatment to carry that burden as well. We all need to do this. We all need to work together. We all need to point it out. We all need to be better. And I do think in the psychedelic ecosystem, in this bubble that we all inhabit, we do think, I think there is that sense that we're better. We're more open-minded, we're more liberal, we're more, we discriminate less. And in many ways, I think that complacency makes it a worse space rather than a better one. We're not better. And because we think we're better, we're actually not addressing things when we should,
That's the paradox. But it's conversations like this and the article, this I think brings us closer to some better picture of that. Théo, what's your view over that? What's your view over safety and ethics?
I think it's a large topics, and I think Francisca and Jan already addressed quite well. So I won't be I will be short, because otherwise I will only echo what they said. But I think on one side, and I would also support what Jakub and this kind of harm reduction organization are doing, and they need to be way more supported, because there is the medical framework. There will be psychedelic treatments but it's going to be, again, really a minority use in the big field of psychedelics, and outside it's not necessarily chaotic, and there are a lot of underground trained people that are doing amazing work. But we need more support for harm reduction organizations, because the more the treatment is going to be implemented, the bigger the risk also people will self-medicate. And we need awareness raising campaign. We need a harm reduction organization. We need a structure to avoid the outside of the medical framework where risk happen as well. That it might be amplified, and that's what we want to avoid. That's a big risk, and by continuing criminalizing these substances outside of the medical framework, and that's my personal opinion there, then we're not going to address this topic. And we need the harm reduction organization, because they're doing amazing groundwork, and we need the support of the governments on that, and not making it worse, because that's what we see in most of the countries with the harm reduction organization we're working with and support psychedelic care, is that there is the government that say, yes, we support harm reduction, and the European Union says it's super important. And at the end, they come at festivals, they shut it down, they are shadow banned on social media. They cannot do the work, which is a crucial work, and that's something we really need to address. And I think we should come as a common front in the psychedelic field to support this work, because it's crucial for all the people in the community. Because when we look at it, a lot of people to take it outside of the medical framework. Like 99% of the people, even more maybe, are out of the medical treatment, especially now it's not implemented. So really need to make that better and support more and maybe more subsidies and not make the life of the harm reduction organization so hard sometimes, as we see in France or in Belgium, which is sometimes insane what the government is doing. So yeah, I think that's an important side also, outside of the psychedelic treatments themselves.
Yeah, definitely. And Jakub, Marika, this is what your organization actually does. So would you like to relate to this?
Jakub, maybe you could start.
Yes, I can start. Theo told almost everything I wanted to tell, so it will be hard. But I think that our moral obligation is to teach people about psychedelics and harm reduction of using psychedelics. Because if we popularize knowledge about deep healing with psychedelics, healing your trauma, healing your depression, anxiety with psychedelics, and this in medical framework, you can't go to this therapy because it's very expensive or it's not available. A lot of people will take these psychedelics in framework with their friends, family, by themselves, and it's important to teach them about harm reduction, teach them about certain setting, and I think that their trips sometimes aren't less valuable than these medical trips in medical frameworks with therapies and so on. Maybe tripping with your friends, with your loved ones, can be as healing as this medical framework. And I think that we should start low and start early. I think that this knowledge about harm reduction should be implemented in the high schools, because we should teach high school students to be more open-minded for this topic and more open-minded for healthy safety, for more open-minded for safety in drug use. So I think it's your turn, Marika, if you want.
Yes, I agree, and maybe I could add one more ethical challenge. I noticed the speed of public enthusiasm, because people hear about psychedelic therapy, like from the internet, podcasts, from some influencers, and often before professional systems are ready to guide them. And that's why I think that transparent education is essential. And I will add the same that Jakub said. This is where harm reduction can be used. We can sneak between those influencers and podcasts and make what professional systems can do right now.
Yeah, definitely. Thank you for saying that, because that's very often the case, that we get too enthusiastic and forget about the threats. I think it's right time to take a look at some of the questions of our viewers, if we have any. I think that it's a good idea. Yes. So yes, I wonder how it is even possible that such safe materials like Amanita muscaria are suddenly being delegalized. Poland case this year, yes, that's correct. While having the true troublemakers like alcohol-free freely avail. Any one of you? This round is just for anyone who would like to comment on that. So, do we have a volunteer to answer this question? Actually, a phrase than the question. To comment on it.
I think I can, because it's a matter of making policy of moral panic, not a policy out of necessity. Because this case of delegalizing Amanita muscaria is effect of moral panic of Polish mainstream media about 2 years ago, because they saw on the groups of on Facebook that people are selling Amanita muscaria online, and media started this topic, and policymakers hooked on this moral panic to make their popularity rise. So they passed this law without further thinking. And this is problem because we don't have systematical solutions for issues related to substances. We have moral panics and people who don't understand this topic. They saw this on the internet that you can buy mushrooms that are these mushrooms when you have a book for children and there is a dangerous mushroom drawing, and it's Amanita muscaria mostly. So people thinking this way, uh, people are selling poisonous shroom online. We should legalize it. It's not systematical thinking. It's not deeper thinking. It's making popularity on moral panic.
Okay. Anyone else, or do we get the next question?
I can maybe just add also, because
Yes.
when the question, how is it even possible? Because politics are not based on scientific facts only. There is a lot of layers, a lot of components when we do politics, and for most of our countries in Europe, at least, there's the cultural component when it comes to alcohol that's very strong. It's very part of our cultural daily lives. There's the business, of course. I mean, alcohol brings a lot of money in. So when considering talking about substances, they are not playing in the same field, let's say, the same level at all. Like, alcohol is so deeply implemented that you cannot compare it with Amanita muscaria, where the how politics will look at it, because you have tons of lobbying when it comes to alcohol. And when you look at sugar, when you look at they bring a lot, and they have a lot of means. When it comes to psychedelics, it's a bit less. When it comes to Amanita muscaria, it's not the same power of action from the societal layers that are lobbying association, industries, and so on. So that's how it is possible, because it's just not the same means. And also, I would like something personally, it is very much my personal view, but always saying, why this substance when not this substance? I feel like you always, like, this is the one, the best one, this is the bad one, and always comparing them. And I think it stigmatizes a lot of people as well. And I think there is this cognitive liberty concept that we should we should have access, and we should decide by ourselves, having all the information available. And it is clearly not the case when we speak about alcohol or other substances. So rather than saying this one should be criminalized and this one should not, I think this overall approach to substances as a society that is rooked, is that a word? Rotten? I don't know.
Yeah.
But yeah, that's my take.
Yeah, thank you very much. Yeah, maybe some more. I think we don't maybe have that many questions as comments, but if you have questions, please, this is the right moment to ask them. But yeah, we've got Tali. Oh, wonderful. Of course, there is business there. Tali says there's enough research to show the numbers of depression, anxiety, and PTSD are way higher in marginalized groups. So coming back to this topic, and then another one, the pharma trend these days is to step away from the therapy during and after the session, very far removed from the concept of safety. Anyone would like to comment on it? Or it's like we've got more, of course, but maybe we can start from commenting on that.
It's hard. Sorry.
Yeah.
No, you can start first.
Oh, thank you. It's a huge part of our work as an organisation is to, you could argue that, Psypan, why does it exist now? Maybe it should exist once the treatments are legally available and it's rolled out. But by then, all of the issues are kind of baked in. Like, for people, I've heard people say, oh yeah, we'll just remove the therapy for now and then we'll bring it back once the treatments are widely available. And we all know that that's never going to happen. It's very unlikely to happen anyway, because once you've got that system in place, once you've got the model in place, then if you've removed therapy, then it's not suddenly going to be brought back in. And we work with organizations, we push for this constantly, getting the A in PAT, even a few years ago. So it's psychedelic assisted therapy. So it's not psychedelic therapy. It's not looking at what I would say is a catalyst, not a cure in itself. To get that included has been a huge effort to get to that point. And so it's not just Saipan that's done that. There's been a huge push from many people, and to have the pushback against that, again, it's understandable. It's partly down to regulation. It's partly down to profit, I would argue, but we really desperately need to maintain that, and that's what we're trying to do. We keep pushing, but you have a lot of people coming into this sector as far as the trials and treatments go on the legal side that are coming from pharmaceutical backgrounds. They don't understand. I mean, you can look at SSRIs. I mean, they are known to be way more effective in conjunction with therapy. Maybe with psychedelics, you have to make the argument that it's essential rather than just a nice to have. But, and when the pushback that you get from certain people in the field, who you probably know who I'm referring to, saying, oh yeah, but people receiving psilocybin are virtually non-verbal during the treatment itself. That's not the argument. You do need somebody there that can help people through these difficult periods of their session or whatever, but we're talking about before and after as well. If you just give someone one of maybe the most profound or challenging experiences of their lives and just throw them back out in the street, and they've got no way of working out what they've experienced, the insights and epiphanies they may have had, then that's a safeguarding risk in itself. And the treatments, even if the outcome isn't, dire after that and somebody goes off the rails, you're still really not using these treatments as effectively as you possibly could,
Yeah, definitely. Marika, you wanted to say something as well.
Yes, I think also there is business in it, but it's not necessarily bad as long as it stays ethical and transparent. I mean, yes, that's true. There's enough research to show that depression, anxiety, or PTSD rates are much higher in marginalized groups. But I think the problem is that the people who need support, the most often have the least access to it. And I want to say that when psychedelic therapy becomes available only in expensive private clinics, we risk repeating the same pattern we already see in this mental health, as this comment said, and help for the privileged scenes for vulnerable. And that's why I believe we should treat this not only as a medical or business opportunity, but as a public health issue.
Mm-hmm. Yeah, that's very important. Mm-hmm. Well, thank you very much. Do we have any more comments to discuss on, or maybe because I think that we still have. Oh, okay. There is one more maybe. Exactly. Also, some psychiatrists tend to be afraid of the supposed interaction risk, while the others do provide, for example, the ketamine-assisted therapy to SSRI or SNRI users. This is insane. Anyone would like to comment on this? Nobody. Well, maybe not about the insane part, but
I mean, I can briefly say something and also maybe connect it to the last comment. And here I'll just kind of take the advantage of the fact that I was at the European Medicines Agency for about a year, so I can bring a little bit of that regulatory lens, which, I mean, in terms of the combinations with medications, the one thing that I wanted to say is that this is something that needs to be researched and understood for psychedelics, because, I mean, it's just unrealistic also in the real world that you're going to be giving these treatments to people who are not on other medications. And I think more and more it's being looked at that way, and that's the way it's being studied. We're not necessarily excluding anymore based on other medication use. So that was kind of on that. But I think regarding the previous question, it was also just kind of a short point, but building on something that Ian had said. I mean, this is something that in terms of the psychiatry paradigm is different. And I think one really important thing, and we can debate about business interests, and, you know, of course it plays a role, but in terms of the regulatory parts, I think you have heard it, I'm sure, early engagement is so important because there's a mutual learning process here about, you know, it is a different model. So we need to understand how best to apply the rules and the frameworks to that, because again, we don't want to cut corners and to, you know, put people in an unsafe situation. And I think talking really early about that, really explaining, because there's a bit of a confusion sometimes from that side of, okay, what are really these treatments? Is it the drug? Is it the psychotherapy? Is it the combination? Like, we need to be clear about these things from the get-go and think, okay, this is our understanding, and then move forward with that. And it's about communication and engagement from the starts.
Definitely, yeah, that's very powerful. Well, you know, what comes to my mind as we speak about also marginalizing, but the safety and ethics and all the other subjects here that have been mentioned, and now also with Tali comments. For those who are not aware, Talia Vron will be the speaker at the conference, at the panel concerning our group that is called Psychedelic Women Network, and we have this very important information to share. What kind of topics we'll be sharing? Because I think that women are also a marginalized group. If you look at it from the perspective of, for example, the research, when you look at it closer, it really can be surprising. That's why we have the wonderful panel to speak about research, about attitudes, about the new horizons about it. There will be also Grace Blessed Hopely. Dr. Grace is our guest to speak about also the research concerning women's health and women's approach towards that. But the conference is also very important because it combines different people from different backgrounds with different approaches, and I'm really happy to be able to say that our guests here are partners and supporters of the conference, and also the speakers. As I said before, Théo, Ian, you will be speakers, and also your organizations are partners of the conference. Jakub, Marika, your organizations as well, and Mózg na Kwasie as well is supporting us. So we are partners to this. Para has been a partner of Hollow Mind since the very beginning. So your support is never ending, and I'm really glad that our paths cross. And I really hope, Francisca, you will be a speaker this year. It was this close of bringing you to the conference. So I really hope this gonna happen this time. I want to invite you all to this meeting because I think that it will also bring a very important voice in this matter. I think that the topics that we have just touched upon will be also discussed. There will be also quite important part that maybe is not straight away concerning our today's conversation, but we have another panel that is concerning Ukrainian war trauma. Last year we had the same topic, but from this year's perspective, we want to concentrate again on women as being the victims, being the veterans, but also being the practitioners. So this will be also the women's voice during the conference. And anyone who hasn't got the ticket yet, there will be an information, I think, it has just appeared, that we have a 10% discount for the code VOICES. But I still would like to appeal once again, Jakub, Marika, maybe you can can help Hollow Mind find the practitioners in small places, small villages, little towns, and send them the invitation, I can really do that. Promise from the whole board. I think we would like to invite groups of people from this particular level to actually get this information and get informed about psychedelic assisted therapy and about psychedelics. So if we can cooperate on that level as well, that would be just wonderful. Before we finish, what can I say? I would like to, first of all, thank you all for this difficult discussion, because I think that this is the discussion without data. This is the discussion without any particular solution, because we cannot have them. We are still ongoing. We are still in progress. And as I see humanity, I think that we will never have ready-made solutions. We will be always progressing. We will be always on the way to something better and better, but hopefully we will never stop. So I'm really, really glad that you have taken part in this discussion, because I think it's a very important discussion to have. But I would like to ask you for the last let's say summary. So what would you like to leave our viewers with when we are closing? Maybe let's start from Jakub.
Oh, it's quite difficult, but I think that I want people have from me at the end of this discussion is the thing I started, that a psychedelic experience doesn't belong to anyone, any company, any laboratory, any clinic. Psychedelic experience is part of our human culture and part of our minds in various different branches, like spirituality, modular thinking, social analyzing society. So this psychedelic experience is something much bigger than any business and any medical experience. It's our cultural heritage of humankind, and we should treat it as it is.
Thank you very much.
Thank you for this discussion. It was very interesting. And
thank you very much for your voice. That's very important. Last comment from Marika.
I think that true safety doesn't start with prohibition. It starts with education, and I believe we don't need more fear about psychedelics. We need so much more knowledge and dialogue, and I think ethics in psychedelic therapy means not just like procedures, but a lot of empathy and access.
Mm-hmm. Thank you very much. That's really powerful. Théo?
Well, I would say to sign the Psychedelic Care Initiative. I don't know if I can say that.
Yes, you too.
No, that will be my last word to sign. And also, thank you so much for the invitation. I wish also we keep our humanity as we move forward, because as a society we see. I fear much in the psychedelic field sometimes that we don't realize also we advancing in a really conservative and leaning far right society, and I think that's the teachings from the psychedelics. We need to have them with us as we move forward in that society we are currently in. So yeah, to keep that in mind.
Definitely. Thank you. And of course, let's mention the website and Psychedelic Care Initiative, because that's very important that we are still gathering the voices. So you can sign the petition. We are gathering 1 million voices, right? Signatures. Théo, maybe you can just say a little bit about that and how people can sign.
Yeah, I can actually put the link in the chat. But we are doing this European Citizen Initiative to get the European Union to take action on psychedelic therapies and make them propose some legislation so that every European Union member states and citizens can have this system. Sorry, the European Citizen Initiative to get psychedelic therapies implemented in the European Union.
Perfect. So please put the link in the comments, because I really feel that people need to get being informed, and we will speak about this more about during the conference. You will be the speaker, but also whoever comes will be able to sign on the spot. So we will be also gathering signatures during the conference, and HoloMind has been supporting psychedelic care from the very beginning. We are really proud of that and happy about this movement. The last comment from Ian.
Yeah, I would say whoever is like involved in this area, this sector, I hate calling it a sector in some ways, but that you always put participants first. If you do that, then you won't go far wrong. And who is the most important factor? What's the most important outcome to measure? It's like how these treatments affect people's well-being and their health and their ongoing lives. It's only by speaking to people that have received these treatments you'll understand what their needs are, what went well, what could be improved, how you work on retreatment, what the ongoing integration needs are, etc. That's how you form best practice, and that's how you reduce harm and safeguard people properly. So yeah, for me, it's all about incorporating lived experience and learning and genuinely listening to people, not just ticking a box. That's how we deliver these treatments and ensure that people get the help they need and get it in the safest way possible.
Yeah, beautiful. Thank you very much. And really closing, the last comment of Francisca.
Yeah, so I think for me, actually, my takeaway from this and kind of final message is connected to something that I was going to mention earlier. So I'm sorry, Magdalena, I don't have recommendations on how to get kind of doctors in Poland involved, but in general, I would like to say that with us at Parea, we go to their conferences, and it reflects this importance of again reaching out to the people outside and engaging. And here I'm not just talking anymore about healthcare professionals, it's all the different groups, and especially, as Ian said, people with lived experiences and the people who we are trying to help. So we kind of align here in the psychedelic ecosystem in many things, and it's about then reaching outside with open minds and empathy and having these open discussions. And this is how things can move forward in the best way, in my view. And it's also very, I think, representative of the topic of the panel today.
Oh, definitely. And I really, really thank you for underlining that. This is very important to say. Great, wonderful. Well, thank you so much. It's been a wonderful time together with you, and I really feel sorry to be finishing. I think we should have more conversations like this, and I really hope we will have. And of course, as we close, I would like to thank all my speakers now for sharing such a thorough and deeply human perspectives, because today we really concentrated on the human aspect and on the very core of what we are talking about, which is the patient, the person, the user. I think that what we've heard today reminds us, or should remind us maybe, that the progress in psychedelic field, it's not really only about therapies, but it's really mostly about justice, empathy, and collaboration, which should be obvious in this environment, as you said, Ian. But sometimes it's really missing. But we are all humans, and we need to build on something. So let's continue. Let's continue this community voices and more. Thank you very much for being part of the dialogue. Let me once again say thank you very much, Jakub, Nowak, Marika Zapór, Théo Giubilei, Ian Roullier, Francisca Silva. My name is Magdalena Kaspryszyn, and I thank you very much for today. You have just watched HoloMind live panel under the topic Voices of the Community, Patient and Advocacy Perspective on Psychedelics. Thank you very much and see you next time.
I'm Marika Zapór from MAPS from the United States, and I'd like to invite people to come to
Hollow Mind 2025 conference.
With the aspiration and the growth potential, I look forward to seeing more.
The Polish specialists, the international ones. Honestly, the translation is so good.
And so being here is just a great opportunity.
Hollow Mind has been able to bring together a group of experts.
And that there's this sense that it's just at the beginning, that this could really expand here in Poland. People about what's going on around the world and to try to